These 5 states have less than 10% of ICU beds left as COVID-19 overwhelms. Hospitals Alabama, Georgia, Texas, Florida and Arkansas have less than 10% left of their ICU bed capacity, according to data from the Department of Health and Human Services. In Georgia, the CEO of Northeast Georgia Health Systems said it had 287 COVID patients Monday morning, which is more than the hospital has had since January. So, in essence, our hospitals are full, Carol Burrell said. We're looking to add space in hallways and conference rooms in waiting areas. Our emergency rooms and our urgent care centers are seeing higher volume than they've seen throughout this pandemic, she said. Hospitals around the country have been stretched as cases have picked back up, but the South, where vaccinations have been lagging, has been particularly hit. Many hospitals have been reporting oxygen shortages. On Monday, data presented by a vaccine advisor from the U.S. Centers for Disease Control and Prevention showed a hospitalization rate 16 times greater in the unvaccinated population than in those vaccinated. This to me seems to be a strong indication that the current epidemiologic curve that we're seeing is really a reflection of failure to vaccinate, not vaccine failure, said Dr. Matthew F. Daly at the CDC Advisory Committee on Immunization Practices meeting. The effect of the low vaccination levels can be seen in Kentucky, where hospitals are overwhelmed with record numbers of COVID-19 patients and 58 of the 96 hospitals are reporting critical staffing shortages, Governor Andy Beshear said Monday. We're living in a reality where some COVID patients who are sick are being treated in their cars when there isn't room for them inside the ER or inside the hospital, Beshear said.
And Mississippi is also struggling. With only 9 ICU beds available in the state, Mississippi Department of Health Senior Deputy and Director Jen Craves said Monday. The number of rising cases has also been seen in children, with the number of children testing positive for COVID-19 earlier this month reaching levels not seen since last winter, according to the American Academy of Pediatrics. The rise in children's infections is worrying experts as parents and students prepare for a new school year. Thousands of students in quarantine. Health experts have been particularly concerned about how cases will trend as school gets underway, and with many regions early in their academic year, thousands of students are already back in quarantine. In Texas, after just the first 2 weeks of school in the Fort Worth Independent School District, more than 3,000 students have been quarantined due to close contact with individuals who tested positive for COVID-19. The district announced a mask mandate earlier this month for all students, employees, and guests, despite ongoing legal battles in the state against Governor Greg Abbott's ban on such mandates. While vaccines are currently the best defense against the spread of the virus, they have not yet been approved for those under the age of 12. But not even those children who are eligible for the protection are not reaping the full benefits. Children ages 12 to 15 are eligible, but less than half of that group is vaccinated with at least 1 dose, according to data published Monday by the CDC. School infections could be cut in half by masking and testing, projections show. While the risk of unvaccinated students becoming infected when they go to school is of concern, a new study shows that masking and testing could help prevent infections in at least half of the population. Adding randomized testing for half of the students biweekly, and assuming at least a 70% compliance with isolation requirements for those who test positive, would cut COVID-19 infections down to less than a quarter of all susceptible students in all scenarios, the researchers' projections suggested. The model assumes that in a class of 500, 2 or 3 students are infected at the start of the school year and that 1 additional case enters the school each week. Dr. Scott Gottlieb, former commissioner of the U.S. Food and Drug Administration, told CBS's Ed O'Keefe on Sunday that we have to throw everything we can at minimizing cases among school children. I don't think that we should be going into the school year lifting the mitigation that may have worked and probably did work last year to control outbreaks in the school setting, until we have firm evidence on what works and what doesn't, he said, adding measures such as frequent testing and putting students in social pods are probably the 2 most effective steps schools can be taking.
Thank you for watching. Please subscribe